and welcome to this week's program of the Rotary E-Club of Silicon Valley. Each week, we connect with and hear from fascinating and inspirational speakers, often with a message focused on our interests in innovation, entrepreneurship, and education. As a Rotary E-Club, we look for ways these programs might foster new approaches to improving communities near and far. We're glad you've joined us and hope you'll enjoy how we're exploring how technology can serve the business of service to others. This week we have Heather Johnston and Chuck Taylor here to present to us about the Rotary Dignitas International Partnership. So a little bit about Heather. She is the president and CEO of Dignitas International and has more than 20 years of experience in international development, as well as has served as the director of programs at Canadian Feed the Children. In this role, she oversaw projects addressing health, education, food security, and climate change, and has led efforts to build capacity with local partners across 6 country programs in Ghana, Ethiopia, Uganda, Haiti, Bolivia, and Canada. Chuck Taylor is a member of the Rotary Club of Uxbridge and has helped facilitate Rotary's extraordinary support for Dignitas. Over the years, Rotarians have raised more than $500,000 for the organization's programs. And Chuck is really inspired by Dignitas's potential for global impact and is really motivated by the organization's research, which is fundamentally changing the way healthcare is delivered in Africa. So without further ado, I will hand it over to Heather and Chuck.
Okay. So we can get started now?
Yes.
Okay. I'm going to put the PowerPoint presentation back up and I will share my screen.
Perfect.
And okay. And Chuck, can you hear me?
I can hear you.
Okay, good. Okay. So are we ready? We can get started? Yeah?
Yes, go ahead. Yeah,
okay.
Go ahead.
Okay. Chuck, I guess you can't move through the PowerPoint presentation, right?
No, but I'm familiar with it, and
Yeah,
I'll know what you're talking about. Let me begin by saying I've been a Rotarian for about 12 years, and at the time I joined Rotary, I was quite excited about what the potential was to do good internationally. And I discovered, quite frankly, quite by accident, that Dignitas was doing work in Malawi that you'll hear a lot about from Heather, and looked into it and was impressed. And my initial impressions have been gratified by seeing the work that these folks do, and I've been very pleased to be very involved in using Rotary and Rotary Global grants to fund various projects that are above and beyond what they'd be able to do with the grants they get from others. And so I guess I'll leave that as by way of a general introduction. I do want your members to appreciate the fact, and perhaps you already do, that using global grants allows us to work with other clubs and take club monies and multiply them up to 3.5 times. So later in the presentation, there's an example from one of the projects that shows how the money grew. But it's a great way to do international work, and it's a great reason to belong to Rotary. So by way of background, Heather, perhaps you could tell them more about Dignitas.
Yeah, sure. Thanks, Chuck. And I just want to say thank you to the club for this opportunity to present. This is a really interesting and innovative format for a Rotary club that's all online. So this is our first time doing a presentation like this. Chuck and I present quite a bit, usually in person to different Rotary clubs, but this is a really great experience. So as Chuck mentioned, I'm going to tell you a little bit about Dignitas, but just to kick off to say that Rotary is a long-term friend and partner of Dignitas. We've been working together for over 10 years. We've accomplished a lot together. And Chuck has been just an absolute wonderful partner for us over these last 10 years. He's very involved in our organization. He's traveled to Malawi to see our programs, and he is out knocking on doors at different Rotary clubs on a fairly continual basis, trying to raise money for our programs, and we just so appreciate it. And we so appreciate Rotary. A little bit about Malawi, because this is the program we want to talk about today that Rotary has supported for over 10 years is in Malawi. Malawi is a small landlocked country in southeastern Africa. Population of now I think well over 20 million. The latest figures that we get that are accurate are about 17, but like a lot of African countries, it has strong population growth, and we can suspect that it's increased significantly over the last few years. Malawi is known as the warm heart of Africa. It's a great place to visit and to travel. It's a beautiful country. The people are warm and friendly, and some people call it Africa for beginners. It's a great place to be and a great place to work. It is one of the poorest countries in the world, and most significantly in relation to our project, it is one of the countries most hardest hit by the AIDS epidemic. Has been able to bring its HIV prevalence down from the height of the epidemic of around 15–16% to below 10% now, but that's globally fairly a significantly high rate for an adult population. But it's also the country, one of the countries that's held up as a success story in getting the AIDS epidemic under control, and we want to talk a little bit about that and how Dignitas and Rotary have contributed to it. I've got two photos here in this presentation. These are both Chuck. And Chuck, maybe I'll just let you briefly speak to the photos. These are your really early involvement in Malawi, because you've been working here for a long time as a Rotarian.
Yeah, on the left is a donation from an organization called AfriCycle. Our club purchased bicycles from AfriCycle to give to the healthcare workers working in the countryside of Malawi. Dignitas pioneered the concept of decentralizing the healthcare. So rather than forcing people to come into the city to visit the hospital because they're poor, they don't really have transport, some would walk for many days to get there. They trained healthcare workers, put them out into existing organizations that the government had in place for social services. And then the healthcare workers would visit the patients in their villages. So by providing bicycles, the healthcare workers were more easily able to get out to those villages and visit more patients in a week. So that's the one on the left. The one on the right is our club along with others, and the woman on the right is a member of the Toronto Club. You'll see the Dignitas logo on that vehicle. We had used a global grant to purchase a vehicle so that Dignitas could do its work.
Thanks, Chuck. So I'm going to move on to the next slide. So a little bit about Dignitas International. We are both a Canadian and an American organization. We're registered here in Canada. We also have 501c status in the US. And we're what we call a global health organization. And we're particularly interested in how do we deliver healthcare in resource-limited settings? What are some of the ways we can build health systems, strengthen health systems? How do we innovate within health systems where we don't have the same resources that we would find in a Western health system? How can we train healthcare workers? How can we get those systems working better? And ultimately, the goal is to be able to ensure that people everywhere can enjoy the right to health, no matter where they live or their status or who they are. We, as an organization, essentially do three things. We work on the front lines of healthcare with patients and healthcare workers to deliver medical care and treatment, and we do that really where it's needed most, often where there's gaps in the healthcare system, where we lack trained staff, we may lack infrastructure, we may lack some of the inputs of a health system, like medications and other equipment. So we're on the front lines. We couple that frontline work with research, high impact research, and this is usually what we would call implementation or operations research, some clinical research, but it's really all focused on how do we, answering the question of how do we deliver better health care in marginalized communities within health systems where really they lack resources. And the final thing we do is some work around advocating for better and more equitable health policy to make sure that health policy and programs is inclusive of all populations and is addressing in an equitable way the healthcare concerns of the populations that we're serving. So those are the three things: the frontline work, the research, and healthcare policy.
Let me make a couple of quick comments. In terms of frontline, the number, well, you're going to get to the numbers, but the number of patients, the growth in the ability to provide support has been amazing. In the area of research, Dignitas has literally affected global health care policy. They have innovated some concepts that have been adopted around the world, and they've made real impact, and we're able to get real leverage from their knowledge to get way beyond Malawi in terms of helping people.
Thanks, Chuck. Okay, I'm going to move on to the next slide. So these are some of the results. Our organization was created at the height of the AIDS epidemic in Malawi, and Malawi was one of the countries that was at the epicenter of that epidemic. So our work for the first 10 plus years focused really on supporting the ministry in the national response to the HIV epidemic. And you can see there that we have been at the forefront of the HIV testing efforts in Malawi, with over almost 3.5 million HIV tests administered through our organization. We have trained close to 5,000 healthcare workers. You can see the results of our research publications, over 79 peer-reviewed research publications, and some of those in really the top research medical journals, The Lancet, the New England Journal of Medicine, and we're very proud of the output of our research team. We have started over 300,000 people on HIV treatment in Malawi, and doing that through 174 public health facilities. So we don't set up our own clinics. We help the ministry to run better clinics within public health facilities.
One of the things that Dignitas is noted for is they don't intend to replace the healthcare system. They want to augment it, strengthen it, and ultimately leave. So they're building capacity in countries that need help.
Yeah, and that's an important point. It's not about trying to set up a parallel health system run by an NGO like Dignitas. It really is about trying to strengthen the health system that belongs to that country and get it functioning better. In the last few years, we've also moved on beyond just working to deliver better care and treatment for people with HIV. We're now doing more and more work in areas like HIV and TB and tuberculosis integration, non-communicable diseases, hypertension, diabetes, and we have a growing program in looking to improve screening for cervical cancer. And so there's lots of ways that Dignitas is expanding and growing and innovating to deliver better health care. About 5 years ago, just this is a bit of an aside for an American audience, but we also started a program up in Northern Ontario looking at how to deliver better care for people living with type 2 diabetes through community health workers, and this is in with Indigenous populations right up in the northern part of our country. And in the U.S., there's a similar situation where we know that health outcomes for Indigenous populations or Aboriginal populations, as they're sometimes called, are not equal to that of the general population, and we're working hard up north to try and close some of those gaps. So I'm going to keep going here. Really quickly, one of the ways that we have worked within the healthcare system in Malawi to deliver better healthcare is through our expert patient program. And I'm highlighting this program out of a number of different strategies that we have, because this is a program that has been highly supported by Rotary, and the results that we've achieved are largely because of the Rotary support that we've had. So expert patients are a key part of our program to strengthen healthcare delivery. These are people who are living with HIV, who are HIV positive. They have self-identified and identified publicly. And they help us to do a number of things. First of all, they support other people living with HIV, particularly at the moment of when there's testing and a positive diagnosis, helping people come to terms with their HIV diagnosis. They carry out.
I think it's important to understand that the literacy rate in Malawi is very low, so people are easily confused, rumors spread, so they really do need emotional support and knowledge about what they're dealing with.
Yeah, I think that is key, and they sometimes need help to kind of link into the healthcare system and make sure that they get started on treatment. So there's a lot of support when people are first diagnosed, and making sure they get connected to the health system and get on treatment, and making sure they return to their treatment. One of the key supports that they also provide is what we call defaulter tracing. So for people who are on antiretroviral treatment for HIV, it's very important that you get on treatment and you stay on your treatment. And sometimes people are very young and very healthy. And so they start treatment, they feel fine, and they very often will default or just drop out of treatment. And that has consequences not only for the individual, because they clearly can get sick, but also there are public health implications, because then we start to develop resistancy. So it's very important that people who get on treatment stay on treatment. So our expert clients will go out into the village. If somebody has consistently missed their appointments, they'll try and track them down and bring them back into the hospital or the health facility. Expert clients also help to fill gaps in the healthcare system. When there's an antiretroviral clinic at the healthcare center, they will be there actually weighing people, taking critical health data, supporting the nurses and clinical officers to care for the patients at the clinic. And expert patients can be there the day and really fill some gaps, what we call task shifting, of taking on some lower level tasks in the health system that free up nurses and clinical officers to do more of the high level diagnostic and treatment work. So in our first global grant, Dignitas, with Rotary support, we were able to greatly expand our expert patient program to over 120 expert patients in 55 health facilities. Today, we have over 300 expert patients that are supporting people living with HIV in 104 health facilities. And I heard at the beginning of the presentation that this club is also, is quite interested in innovation. This maybe doesn't seem like something that's innovative, but in a way it is. It really is about trying to find a way to deliver healthcare that is cost effective, that is using local resources, people who are available. This is a sustainable model, and it's also using expertise that exists within the community. It's not relying on outside technology or outside resources, human or technical. It's really a very simple, innovative way of providing healthcare in a place where often these resources are scarce. Before I move on, Chuck, did you have anything you wanted to add to that?
I would simply add that in addition to all of the healthcare benefits, we're providing employment, because yes, the expert patients get an annual stipend of $500 US a year, which goes a long way in a country in Malawi.
Yes. Okay. The next slide is a table that we've done up, and this is really just to show the powerful effect of a global grant. And I don't know, Chuck, do you want to, if you've got the slide, the table in front of you, do you want to walk through?
I don't want to go through this in detail if you are familiar with how global grants work. Would you nod if you do, or just let me know? Basically, what happens is clubs commit money. So we go out with our proposal to support Dignitas, in this case, hire 120 expert patients, and we lay out what we believe the benefits would be, and so on, as you would if you were presenting a new concept. And clubs commit money. So from our district, we got, and these are US dollars, 28,664 donated. Out of our district, London, Ontario, a club called Burlington Lakeshore, and Ottawa, our capital, donated the money you see in column 1. So we raised $39,000 US from clubs. Districts use money from the foundation to match, and they will match, in our case, up to $25,000. So I raised more, but they support $25,000. Then if the grant is approved by Rotary International, and that requires us to go through quite a few hoops, which is appropriate. They want to make sure the money's being well used. They will match 50% of club money and 100% of district money, and really build up the value of those donations. So we were able to put together altogether for this one $126,000 to hire 120 expert patient mothers, which if you do the math, it's a little more than $1,000 each. But when you see the results on the next page, we end up being just slightly more than $1 a patient. And it's quite incredible being able to multiply our money that way and do so much good.
Okay. So this is what we achieved together from this first round of the first global grant that we had. I won't walk through all the numbers are on the screen. Some of them, just to highlight, is that we supported over 120,000 HIV positive women.
Which is about $1 per patient.
Right, and almost 50,000 of those were pregnant or breastfeeding. Expert patients are a key part of our maternal health program. We call them expert mothers. We know that one of the key strategies to ending the HIV and AIDS virus is to stop the mother-to-child transmission. And the only way to do that is to get HIV pregnant women or breastfeeding women on antiretroviral treatment and have them remain on treatment for the rest of their lives. And we have successfully brought the mother-to-child transmission rate in Malawi, which is at the forefront of this, from around 16% to down below, well below 5%, which is almost on par with a developed country. This is an absolutely astounding result. So fewer than 5% of children born to HIV positive mothers are born with the HIV virus. The rest are HIV free. And that is, as I said, it's a remarkable achievement, and these expert patients that have been funded through Rotary are a key part of that. They're the ones, with mothers when they're diagnosed. They're the ones coaching mothers to get on treatment, to stay on treatment. They're the ones following up when they miss appointments, and there's just significant logistical challenges that are resolved through the work that these expert patients and expert moms do. So I wanted to highlight the role that they have played in significantly lowering mother-to-child transmission rates.
The other thing to note is that by keeping the mother on antiretrovirals for life, she does not transmit HIV through breast milk to her child. In the past, there was a process during the birthing that they would give a drug that would result in the child being HIV-free, but Dignitas followed up on those HIV-free babies and discovered that by age 5, most of them had HIV, and the answer was breast milk. So they adopted a program of putting a mother on antiretrovirals from the moment of pregnancy for the remainder of her life, so the child would actually grow up HIV-free, and she would live to raise that child.
Thanks, Chuck. Okay, I'm going to, so anyways, we are very proud of these results that we've achieved with Rotary, Rotary support. I'm going to move on now. We have a new global grant that we're implementing now through a new Rotary partnership, or I guess continued Rotary partnership, but a new project. This is a program that is working with young mothers who are living with HIV. Dignitas, for a number of years, has operated on a teen club program, which works with HIV-positive teens, providing clinical and medical care, medications, but also psychosocial support. We've done some evaluative research that has shown us that teens who are in Teen Club are more than 3 times likely to stay on treatment throughout their adolescent years than kids who are not on treatment. And again, that for people who are on treatment, it's incredibly important that they get on treatment and they stay on in order to stay healthy and in order to not transmit the virus. We know.
Hey, Heather,
yeah.
I'm looking at the time, and I think we should leave the presentation there.
Yeah.
We have just received funding for this particular program from the foundation. The numbers are a little larger than last time because we got a little Government of Canada money as well. But the same matching by district and by Rotary Foundation happened, and that one is about to start, and it's an 18-month program. So at this time, we actually don't have an open global grant. But that doesn't mean we won't have one very soon. And we would hope we'd be able to come back and talk to you about that when we have a proposal, because you may want to consider joining in and receiving the benefits of the matching funding that you can get from the foundation.
Right. So I guess, Chuck, if we can end it there. That is that's the program that we have ongoing now. And I just the next slide is a little bit of the work we have on now, and the impact that we hope to have in the coming 18 months on this new Rotary project. And again, this is a proven strategy of working with adolescents, and this latest project is focusing on young mothers teenage mothers who are living with children, and this is really about keeping those teen moms healthy, keeping their babies HIV free. So I think we can end it there, and I guess there's no, this is recorded, it's online, there's no questions, but we'll just say thank you for the opportunity to present.
Great, thank you so much, Heather and Chuck. Actually, if I have a few questions, if maybe Roger has a few questions, I would love to be able to ask them if that's okay.
Yeah.
You can go ahead and unshare your screen if you would like.
Right. Okay. Yes.
Yep.
Okay. Got it.
Great.
Yeah. Okay.
Perfect. So again, thank you so much, Heather, Chuck. That was incredible. Dignitas seems to just, wow, like that. Not only is the partnership amazing, that you all are raising so much money. I am in awe and shock and admiration about how much you've done to really help, the people of Malawi. Like I'm, wow, like I that's amazing.
Thank you.
Yeah. And I guess my big question, one is how can I get involved? I am pursuing medical school. I really want to become a doctor, and specifically a gynecologist. And a lot of the issues that you were raising, really do stem from kind of reproductive health and how we can support young women in their reproductive health journey. So that would, I would love to get involved with an organization like yours.
Okay.
Yeah. And I'm not in med school yet, but I'm slowly on that journey. So you kind of talked about kind of the future. Can you talk maybe a little bit more of how how the Rotary clubs are supporting, and again what else we can do to support?
Right. So the main support, I guess is twofold. The most important support is clearly the fundraising that Rotary does for us. And as Chuck pointed out, it's a really unique model because clubs can give very small amounts of money, sometimes 1,000, up to 5,000. That gets matched at the district by the global grant in Canada. It also gets matched by the government of Canada. So we can actually raise a fairly small amount locally through clubs that ends up being a significant amount of this grant is about $180,000, and we can do something really significant with that. So that's the biggest. I mean, obviously the biggest need is for funding. The local Rotary Club in Malawi, it's the Rotary Club of Limbe, which is the suburb of Blantyre, the second largest city in Malawi. They also make a small symbolic financial contribution to the grant, but they help to manage the grant. They sometimes will send members out to take a look and to see what's happening. Sometimes they'll participate in evaluations, but we let them get involved really as much as they would like. So we have had Rotarians over from different Toronto clubs to visit. Sometimes they're on sweat equity trips, and they stop by and they visit us. But sometimes we've had a couple of sort of designated visits. So yeah, those are sort of the ways I guess that come to mind to get involved for sure.
That's super cool. Thank you so much.
Yeah.
Roger, do you have any questions? Oh, you're muted.
Okay, now I'm unmuted. A couple questions. First of all, in terms of the HIV in this country, have the numbers been going down in terms of recorded incidents?
In Canada or in Malawi?
In Malawi.
Yes. So the HIV prevalence has dropped considerably since the height of the epidemic. And it at the height was 16-17%. It's now down, sitting just below 10%. But it is on a trajectory. There are fewer and fewer new cases. But most importantly, as I said, the big success story in Malawi is this mother-to-child transmission. So if you can stop that, and they are well on their way to really ending. I mean, in Canada or in the States, there would be very, very few babies born with HIV because we have the medical technology to halt the transmission. And if a woman follows to the, exactly the medication and the medical guidelines during pregnancy and birth and breastfeeding, basically the HIV virus will not be transmitted. Unfortunately, in places like Malawi, the healthcare system can't always isn't able always to deliver that level of care, but they're making significant progress. And so it's the mother-to-child transmission rate that has dropped so significantly, 18% down to below 5%. And that is really what is going to help bring that virus to an end in Malawi.
Yes, it's our hopes that we can create what we call a HIV-free generation, and that when the parents of this generation die, the disease will die with them. Now, obviously, that requires a great deal of education in terms of being responsible and making sure that people do understand what the disease is and how it gets transmitted. The Gates Foundation, I believe, is very close to funding the development of a vaccine that will immunize people from HIV, and that will probably be the next step. But if we can test and treat everyone, that would go a long way to, much like with polio, if you can get people who are, it's a different situation with polio, you're preventing it, but if you can get people on antiretrovirals, when you're on antiretrovirals, your HIV load is so low, transmission is very unlikely, and that is the way we can defeat this disease.
Thank you.
Some days when I listen to Chuck, I think I should hire him.
I think that would be a smart investment. Great. Any other questions? I have so many more, but in the interest of time, I don't want to take up too much. But
yeah, and feel free to. I think you must have our email somewhere, so feel free to reach out if you've got more questions. We'd be happy to chat.
Of course.
And when we do have a global grant ready to go, we would like the chance to review it with you, and perhaps you'd like to join it. Another thing that occurred to me is that we wanted to try to do something with our First Nations group in Sioux Lookout. We could do an international grant whereby you would be the international partner and we would be the host partner. International grants need an international partner. We can't fund the grant from within our own country. But as the United States is a separate country, you could partner with us and we could together do an international grant.
That would be really cool. That would be really cool. Great. Well, thank you so much. And just to wrap up the recording, so we would, well, again, so many thanks to both you, Heather and Chuck. This was, again, phenomenal presentation. And for those of you who are listening to this recording, we would like to encourage you to let us know what you think. And you'll find our tool for sharing, a Discus tool for sharing and responding to comments. So please take a moment to add to the conversation. And if maybe Heather and Chuck, if you can look back after this recording and after we upload it to answer some more questions, that'd be really great.
Sure. When does it get uploaded? Immediately, or?
I'll let you know. Yeah, I'll send you all an email. Yeah, it should be in a few weeks.
Okay, great.
And members and Rotarian guests, make sure you fill out the attendance section as well. It helps us know about the reach of our efforts and serves as a makeup for a missed meeting. If you put your email address properly below, you'll get a message that you can pass along to your club secretary. And so, as always, we would like to give the final word to our speakers. So Heather and Chuck, the mic is yours.
Now, just to note again, to say from Dignitas, to say thank you for the opportunity to speak to the club, but also thank you to Rotary for over 10 years of support, of sustained support, and just an acknowledgement of what we have achieved together. And I would just add that this is a wonderful example, I believe, of the power of Rotary to do good. It's very rewarding for me personally, but also for our club members and the other clubs who are working with us to work with such a successful organization and see tremendous results being achieved. So thank you for having us. I really appreciate it.
Thank you so much.